Aida Safar. I'm a pathologist and I serve as a cancer liaison physician here at Mercy Medical Center, Cancer Center. Our work as a pathologist here is basically, I'm a part of a group of 3 pathologists, and of course we do the interpretation of patient samples, biopsies or resection, and the clinical specimens as well. For cancer patients, we are very aware of the gravity of the diagnosis and the effect and impact it has on the patient and their family. So we try to process the specimens as accurately as possible, give them an accurate result, give them a quick result, because we know this patient is very anxious to hear back their results, and we communicate very closely with our physicians and surgeons in order to make sure everybody is on the same page for best outcome for our patients. The Outstanding Achievement Award, as the name indicates, is outstanding. It just is an attestation for the high quality work that we all share as a team to do here at Mercy. And it is just like stamp of approval, if you will, that you have achieved that because your statistics, your data, your work is really in the elite group. With that being said, and we are all very, very proud of achieving that, our focus really here at Mercy is the patient. We really care about the patient. We really want the patient to be kind of guided into the best outcome through this very difficult journey that they are going through. So I think the strength in our program really comes from the work that is put together by the team. Like I said, the expertise of the physicians and the surgeons and oncologists and everyone involved in the care of the patient is really very, very important, very high. And also, I think what is unique to our program is the cancer nurse navigators, because these are patients advocates. They know the patient on a personal level. They know their problems. They know what they are going through, and they can guide them to the best possible options that they can go through this process. So they can tell them about their services that they need according to their needs. So that is really important. And I think at Mercy, the patient will find themselves like treated on a personal level, individual level, rather than a number. Like some other places are a bit too big or too large for them to find out the process. So I'm a pathologist, of course, and that's why I feel like our role is really critical as well. We're in the back stage, so patients don't see us, they don't know we exist sometimes, but we communicate very closely and very clearly with our physicians and surgeons, and through our reports, and any case that is a little bit difficult or outside the norm, we pick up the phone, we talk to them, and we discuss it together. And also we have like multidisciplinary meetings and committees that we also discuss patients' cases, cancer, tumor boards, and so on and so forth. So we do a lot of the work here at Mercy in-house, so we have capabilities to do the diagnosis for the most part, and sometimes when we need like additional, more sophisticated studies, we definitely have association with other reference labs, so we send specimens in a very timely manner in order to get the most accurate, the best answer, best option, and gold standard for our patients. So we are really working together to get them the best answer we can do in a very, very reasonable time. Therefore, the patient doesn't stress out and get more anxious than they need to. But having it 4 times in a row, I think in my mind indicates that we are doing a good job for a long time. It's not just something we just acquired, we just got better. We were not doing a good job and now we got better. It's like, it's a long history. It's now recognized. I mean, that's the point of the campaign, I guess, to make patients and the community aware that they have a very good service right here in their neighborhood, and they don't really need to go far in order to get the best possible care. The primary care physicians, I think it is important for them to also recognize that we have all the services they need for their patients, we have all the specialties they need for their patients, and we are here to help them get that service, and also to discuss any case for them, because many places have been sending their biopsies all across the countries for reference labs. In reference labs, you don't know the pathologist. I mean, I'm sure they're all very good pathologists and qualified people that are reading the samples. However, there are sometimes small questions or things that are ambiguous in the report that come back and they don't quite understand it. But if they know who we are, they know that they can trust us. We are really doing very good job for their patients and our patients. They can pick up the phone and talk, and most of the time they come here and look at the case with us. We share the information, we show them what we mean, and then it's clearer for them when they discuss the case with their patients face to face. Because like I said, we're in the back stage, patients don't see us. I mean, it's very important for them to know who they are dealing with, and that they can call us right away. And many times, I can tell you, many times we get calls about a case that is urgent. They have very anxious patient, they want it immediately, they want something. So we expedite cases according to the need of the physician and the patient, and we have ways of doing things. I mean, and our turnaround time is pretty outstanding. We give them the reports in a very timely manner, like within 2 days, most of the time, 99% of the time. But we can even do better in terms of reassuring and helping the physicians know that they are getting the best care possible and the best diagnosis possible. Many cases that we diagnose here at Mercy end up going for another facility for second opinion or so on, for treatment, for whatever. And they always request the material to review it and to go over and make sure. And we rarely have any change in our care. So that goes back to the reassurance that the care that the patients are going to be getting is really similar and is not any less than any other institution. So I think this is very important for them to know. Just because you are in a smaller city or a smaller cancer center does not mean you are getting smaller service or less quality service. You are actually getting the best possible quality nationwide, and that is why we are one of the 16 cancer centers that got this award. No, I think we have the commitment from everybody on staff here to do the best possible job we can. We always strive for improvement, of course, but we are always thinking of the patient and the person behind any specimen that we receive. And that goes, to all my colleagues. Like I mentioned, we have 2 other pathologists here in the department, and we consult with each other all the time. We show cases, we take opinions, and we discuss it with our physicians. 4 awards for you is truly for you. We are here for you to help you get through this journey, and we're here to help you in the best possible way. We have your back.